hypertension and diabetes. These are called twin threats. Why is it?
It affects almost every house. Initially, they are not symptomatic, so it can be present there and it can damage organs. That's why these are called twin threats.
How important is obesity in developing these conditions?
Obesity is the mother of these two conditions. Obesity is a modified risk factor for both of these conditions.
When left uncontrolled, if a person is having both hypertension and diabetes, what are the conditions he will develop? What other risks are there?
Complications, if you start from head, can be stroke. They can have brain hemorrhage. That if you move down, they can have heart attacks, heart failure. As you just said, they can have kidney problems. They can have chronic kidney disease or dialysis. They can have problems with the leg vessels and giving rise to gangrenes and amputations.
We live in an era where social media is like something you have it on your hand and you scroll everything, you see everything, you get the information. Is it like if you eat something particularly that you will not have hypertension? If you will take a certain medication, you will not have diabetes. Is it so?
Social medias and these platforms give us information, but in most of the case, it is misinformation. If the doctor finds there is some scientific base with that, he will guide, but they should not take the decision on their own.
Hello and welcome to another episode of Heart Talks. I'm your host Fajr, and today we're diving into a topic that affects millions of people across the globe. Hypertension and diabetes, often referred to as twin threats. To guide us through this conversation, we have with us Dr. Khurshid Bhat, a renowned DM endocrinologist from Srinagar. Dr. Saab, thank you so much for joining us.
Thank you for having me here to speak on this very important topic.
Doctor, let's start with the basics. Hypertension and diabetes. These are called twin threats. Why is it?
Yeah, hypertension and diabetes, they are called twin threats because of so many reasons. One of the important reasons is that it affects almost every house. Second is that initially they are not symptomatic, so it can be present there and it can damage organs and we may not recognize it. And it affects almost every organ of the body, starting from brain, heart, kidneys. That's why these are called twin threats. We need to know more about these conditions and we need to look whether we have these conditions so that we can pick them early and we can prevent the damage caused by these conditions.
How common is it for a patient to have both these conditions at the same time?
Yeah, basically the reasons for having hypertension, the risk factors for having hypertension and risk factors for having diabetes, they are almost same. That's why these two conditions in many cases occur simultaneously in a person. If we see persons with diabetes, if we have got 3 persons with diabetes, among them 2 will be having hypertension. And if we see person with hypertension, out of 2, 1 will be having diabetes. So these are very common. It's a very common thing that both the two conditions are present in an individual.
These two conditions, hypertension and talking about diabetes, these are always referred to as they are symptomless. So how can one know that they are silently heading towards these two conditions?
And this is a very important question because as you said, initially these two conditions don't produce any symptoms, especially hypertension. So they can just present with organ failure. They can just present heart attack or kidney failure or a stroke. That's why we need to know more about these conditions. Similarly, as far as diabetes is concerned, it can be symptomless for so many years, and patient can present with organ dysfunction. In fact, it's very common in our hospitals that we see patients presenting with heart attack, myocardial infarction, and once we look into the cause, we found the patient is having diabetes for so long. So the essence of this question is that since they are very symptomless initially to begin with, that's how we have to look into for these conditions when they are symptomless. There comes the role of screening, getting yourself tested and checked from time to time.
Talking about screening, at what age should a person start screening himself? Because often these two things are related to older adults. So at what age is the ideal age to start screening for these two twin threats?
See, these two conditions are no longer problems for older addicts. We see people who are very young in their youth to have diabetes as well as hypertension. There are various reasons for that. We'll not dwell into that. But answering your question in one word is that at the age of 18 years, everybody should be screened for diabetes and hypertension. Then if they are not there, then from say after every 2 to 3 years, again we should screen oneself for diabetes and hypertension. These are guidelines for adults. Then sometimes we need to screen children in schools also. So because there's a tracking of blood pressure over a period of time. But generally speaking, for any adults at the age of 18 should be the point where oneself should be checked.
Being talking about the family history, how important is it to check the family history, that if your family is having hypertension or diabetes, how much does it stake you up at an odd that you are going to have these two conditions?
There are two aspects. One is if we have our family members who has one of these conditions or both of these conditions, then the risk of having these conditions in those individuals increase. So it's very important that we screen rest of the people. Suppose one person in a family has been diagnosed to have diabetes, and another his relation is accompanying that person. So there's a chance that person may also have. As we just said, it is symptomatic. It is symptomless initially. So any family member having diabetes or hypertension, it gives us a chance to screen rest of the things, because anyway that person will have been asymptomatic for some period of time. So a risk of having any of these conditions increases if there's a family member. But overall, our risk is very high. So with or without regard of family history, we should get screened for these two conditions.
Are these two conditions purely genetic, or are there any other factors that make a person more vulnerable to these diseases?
Yeah, genetics, they play a part of the role. It's not genetics plays a role in both of these conditions, but environment is also responsible for so many things. So both genes and environment, they play a role in having these conditions.
How important is obesity in developing these conditions?
See, if we see obesity, we can say obesity is the mother of these two conditions. If we generally say risk factor for having hypertension or diabetes, we divide those risk factors into two. One is modifiable and non-modifiable. Non-modifiable means as the age of a person increases, the risk of having diabetes or hypertension increases. If there is a family member who has history of hypertension or diabetes, then risk of having these conditions increases. But we cannot change those things. We are born in a family where one of our parents has these conditions. We cannot change that. Similarly, we cannot stop our age. So these are called non-modifiable risk factors. But modifiable risk factor, one of the most important modifiable risk factor is obesity. Because if a person is having genetic tendency to develop diabetes or hypertension, and he keeps check on his or her weight, then we can modulate that risk. We can decrease that risk. So obesity is a modified risk factor for both of these conditions. Then lack of exercise is a modified risk factor for these conditions. Then we can then stress, lack of sleep, and smoking, all those factors, they are something modifiable risk factors. What I want to say is that if we target these risk factors, we can bring down our risk of having diabetes and obesity to a large extent.
We often talk about diet and exercise, as you have also mentioned. But somehow some people, they do diet, they do exercise, but they don't have proper sleep cycle. They are undergoing constant stress. So for them, is there they are having, according to them, a healthy lifestyle? They are having a proper diet, a proper exercise, but still are they at a risk of having these two twin threats or not?
See, health is not only about having good food. It is also having about good sleep, good exercise. So those things are also very important. If even and we see if any person is having hypertension or diabetes and they are stressed, their treatment becomes more complicated. It's very difficult to control their conditions. But once we relieve their stress, once they get good sleep, so the chances of getting their two medical conditions into control is quite easy at that point of time. So both stress as well as this sleep, they are very important to be addressed so that we can control a person's condition as such, while as we can also control overall population risk.
If these two conditions are left uncontrolled, unmonitored, unchecked, how can it affect an individual? At what level?
See, there are two things. One is, as I said, if we say the most common reason for having chronic kidney disease, kidney failure, is uncontrolled diabetes and hypertension. If you say most common reason for having strokes is again diabetes or hypertension, uncontrolled, I mean to say. And most common reason for having, say, heart attacks is again these two conditions. So if we leave these things unchecked and controlled, then risk of having these complications will increase to a large extent. If we are not able to manage the simple conditions, if a person is not able to manage and his simple condition like diabetes, hypertension, we have to imagine how difficult it will be for that person to manage, say, diabetes and heart attack, diabetes and kidney failure, hypertension, heart attack. So it's very important that these two conditions are controlled so that we will prevent the complications which would otherwise arrive if these things are left untreated.
Dr. Saab, you talked about that these two conditions affect the kidneys first. Why is that the kidneys are so vulnerable?
See, kidneys are vulnerable because if we say diabetes and hypertension, both of these actually affect the blood vessels, vasculature, the inside wall of the arteries. So, kidneys is actually a bunch of, it is highly vascular. So, that's how the filtration occurs over there. That's why these two conditions, one is they affect the vascular health, they affect the kidney vessels, and that leads to the development of kidney impairment and chronic kidney disease.
One question that arises when we call it as twin threat is that can one condition lead to another condition? Can, if a person is having diabetes, is he at the chance that he is also having hypertension or vice versa?
Yeah, actually, hypertension sort of begets diabetes, and diabetes begets hypertension. There are various reasons for that. As I said, the risk factors to have any of these conditions is same for both these conditions. So hypertension is a very significant risk factor for diabetes, and diabetes vice versa is a significant risk factor to have hypertension.
Talking about hypertension, it's called a silent killer. And diabetes, it's also a disease. Like some patients think that this a lifelong disease? First of all, I want to clear it. Is it like if someone is having it, he will have it or she will have it for the rest of the lives? He'll have to take medications for the rest of the life.
It's a very, very important question. This question is very dear to me because the population we treat, we have to distinguish the nature of the disease. If anybody is having, say, has some problem with gallbladder, he gets a surgery, then that chapter is closed. If anybody is having, say, a common cold, gets treatment for some days, and that chapter is closed. But for hypertension and diabetes, they are lifelong issues. And that's why we need to take medicine for these two conditions and also for hypothyroid and other things lifelong. Why is it very important to discuss is that in our community, there's a myth like if we start medication once, then we have to take it lifelong. But we have to see it from the other spectrum because the disease remains lifelong. That's why we have to take the medication lifelong. So because the drugs, they help, these medications, they help to bring the things towards normal. But once you stop the medication, again the things will go to the abnormal side. So whether we have got hypertension, whether we have got diabetes, the treatment for them is lifelong. So this is to be understood.
When talking about hypertension, like these two things, they are associated with two things, salt and sugar. Like, can you just tell us about how these two components, salt and sugar, affect these two threats?
See, if we talk of India per se and Kashmir in particular, our consumption, salt consumption is tremendous than what is actually required. Everybody requires about 2.5 to 5 grams of salt in a day. But the consumption here is around 12 to 15 grams in a day. Means we take 3 times the salt what is required. This salt in many of the individuals' kidneys are not able to handle that, and it becomes a very significant risk factor for development of volume overload and hypertension. So, generally speaking, every food which we eat, God has kept some salt over there. But what we add more salt to the things, especially the non chai, pickles, and other things, processed foods. So overall, the consumption which was good for us, it becomes more than that, and the same salt becomes harmful. Similarly, is with sugar. If a person is having diabetes, then he should not take simple sugars because he will not be able to handle that. But otherwise, if a person does not have diabetes, if he takes some sugar, he will be able to handle that. In that case, there is no problem. But we have to address other things like, as I said, we have to work on modified risk factors. If a person is already too fat, so sugar may be harmful for that. He has to lose some kgs.
Uh, you told that obesity. You talked about obesity. You talked about diet, proper sleep. Is there anything like if someone is like seeing our podcast right now, he's thinking that I might be at the risk of having or developing these two threats. What should he do first? Like, what should he do in his life apart from these? Some basic steps or basic guide that can help them prevent these two threats.
See, I'll tell you one thing. Nobody should think that, am I at risk? Everybody is at risk. We Asians and Indians, we are at risk of having both the conditions. And once we understand that we are at risk, then we have to look for these two conditions. If you ask me, Doctor Sir, do you have diabetes? If I say no, if you ask me, have you got yourself checked? If I say no, then how can it be? So everybody has to get checked for these two conditions. As I said, we should begin from college level at the age of 18. This is one aspect. First message should be from this podcast is that we are at risk. We should be checked. We should get ourselves checked and get our family members checked. One of our family members has diabetes. What prevents us from getting that? We have to get it checked. This is one aspect. Second aspect, what can we do to bring down that risk? As we just discussed that we have to focus on modifiable risk factors. We cannot change our non-modified risk factors. For that, we have to understand what's our weight. Is our weight ideal? Or are we overweight or obese? If we are overweight or obese, then we should try to bring our weight towards normal level. Now, how can one person know is my weight ideal? So, there's a simple way to understand that. First of all, we have to measure our weight.
Yeah.
Then we have to measure our height in centimeters. And if a person's height is say 170 centimeter, we have to minus 100 from that. So it remains 70 remains. His weight should be around 70. His weight should be. This is how a person will simply know, am I overweight or my weight is towards ideal. So this is a rough estimate, but fairly good estimate. So we have to focus on our weight. First of all, we should have realization. No, I'm overweight or I am having obesity. So we have to try our lifestyle in that way so that we decrease our weight. This is one part. Second part is whether we are overweight or we are not overweight. Exercise plays a very important role. We have to do exercise. Hardly in our part of the world people do exercise on a regular basis. And our female folk, they are of the opinion or we can say an illusion that they do so many things at home that will count in the exercise, but that doesn't count into exercise, because the level of exercise we have to do is that our circulatory system should have some sort of stress. There should be heart rate should increase. There should be a change in the pattern of our breathing. That has an impact on blood pressure. It will lower the blood pressure. That has an impact on say blood sugar. That will lower. So they are doing a lot of things at home, but that is not helping their health. Two. Third part is, as we just said, is that we have to decrease our stress level. Everybody has some can have negative stimuli, but we have to have that much of capability to decrease the effect of stress on our bodies. Then we have to have a proper sleep. Two. Then, apart from that, other risk factors like smoking and smoking, and as I said, sleep and other things, we have to focus on all those things. If we do those things at a community level, then definitely the overall risk and overall prevalence of these two conditions will decrease. And I'll just give you an example. If it is said that everybody in this world has to mandatory do a walk of 30 minutes daily, well, things will come down. This will be the best intervention. And we have to, I forgot about that, these junk foods, processed foods, beverage, they also, their usage also to be decreased to prevent these conditions.
So, all these conditions that you talked about, lack of sleep, junk food, processed food, we see that these things are more common among youngsters, the new generation that's coming up, the children that they are brought up with screen times, with processed foods. Uh, how do you see it, like in next 20, 30 years? Would these things like these hypertension patients or diabetes patients, will it go on increasing, or do you think that we need to change it right now? We should initiate something that after 30 years, 40 years, we'll see less patients with hypertension and diabetes.
No, the way we have trends right now, everybody will understand that the things are going from bad to worse. Previously, the age of onset of diabetes, mean age of onset of diabetes was around 48 years. But now, mean age of onset of diabetes is just 28 years. We see school going, higher secondary going, college going children having diabetes, not type 1 diabetes, type 2 diabetes, because of the lifestyle. A lot of processed foods, no exercise, then the screen time has compounded the things. We get families. The last time, uh, father was having diabetes, obesity, mother was having diabetes, obesity. They had a daughter, she was also having certain issues. And I told them that you need to change your kitchen. They said, I will change from one room to other. I said, this is not the change. You need to change the way you cook over there, the things that go over there. So unless the things are addressed right now, it's very unlikely that we may see less of the patients. We are seeing more and more of the patients. We need to act now, and things are doable from our community participation level, at from family level, community level, government level. So it's only then we can have less number, we can control these conditions in due course of time.
You talked about diabetes, having type 1 or type 2 diabetes. Can you tell us a like brief thing about type 1, type 2? Because some of the viewers might be seeing this right now, they might have this condition.
See, type 1 diabetes, why I said was that because we said diabetes in young adolescents and children now. Previously, any diabetes in children would be type 1 diabetes, which was a totally autoimmune conditions. The reason for having that diabetes was totally different. But now, type 2 diabetes is also being seen, in fact, is more common in children right now because of the lifestyle. Children are obese, they don't play, they have a lot of screen time, and they keep on eating. They're busy with the screen and other things. They don't know how much calories they have taken. The things have shifted from type 1 to type 2 diabetes even in children. So this is an alarming situation. Type 1 diabetes is an autoimmune condition where there is a destruction of beta cells of pancreas and it requires insulin all along, which was seen previously predominantly in children. But now we have a type 2 diabetes in children as well.
Dr. Sab, talking about gender. Are these two diseases gender neutral, or we see that it is affecting a particular gender more?
And we can see both of these are gender neutral. Men and women are equally at risk and equally have got these conditions. There are some epidemiological studies which say diabetes is more common in women, but from a general, that is the preamble of the hardcore conference and other things to see those things. But in this podcast, the message is clear. It is gender neutral, and anybody can be affected. In fact, everybody is at risk.
When left uncontrolled, if a person is having both hypertension and diabetes, what are the conditions he will develop? What other risks are there?
So, if these two conditions are left untreated, uncontrolled, then they can present with complications. A person is likely to develop complications arising from both of these conditions. Those complications, if you start from head, can be stroke, they can have brain hemorrhage, or they can have traumas in the brain vessels. Then if we move down, they can have heart attacks, heart failure. Then going down them, as you just said, they can have kidney problems, they can have chronic kidney disease, requiring dialysis. If we move down, they can have problems with the leg vessels and giving rise to gangrenes and amputations. So it's very dangerous that these two conditions, if we leave untreated and uncontrolled for some period of time, then things are going to get worse because many complications will set in, and treatment and management would be more complex.
One more thing I want to ask is that I've seen people that are suffering from diabetes or hypertension, and once they went to a doctor like 4 or 5 years ago, they are still taking the same thing. Like they are saying, okay, we have this medicine, we are going to take it lifelong without even getting back to the doctor. Is it okay that once you prescribe something, he has to take it for the lifetime, or does constant like visits to a doctor?
Hey, see, once we devise a treatment plan for any person at one point of time and it works, how will we know it works is that we monitor the condition for which it has been given. Like if we have given it for hypertension, we'll monitor blood pressure. When your blood pressure is normal, we'll continue with that. Similar principles goes with diabetes. But as I said, as the person ages, these things become more their severity can sometimes increase. So they have to monitor from time to time. If they are monitoring from time to time and they are within the target, they can continue that mix. But if they are not monitoring, then we cannot just presume that these medicine will last for years and years and years. So important is that if anybody is taking these medications, and he is monitoring that thing, but he is monitoring his sugar and blood pressure. If they are controlled, they can fairly continue with those medications. But if they are monitoring and if it is not getting controlled, it has worsened, and they have to visit the doctor, and then their treatment may be modified. Anyway, even if it is controlled, because we need to screen certain other organ functions from time to time. So 6 monthly, even if they are well controlled at home, 6 monthly or annually, they should visit the doctor. This is once they are monitoring. If they are not monitoring, nothing can be said. We can't actually.
We live in an era where social media is like something you have it in on your hand, and you scroll everything, you see everything, you get the information. And oftentimes we see that some people on Instagram, on any other platform, they promote certain foods and say like, or certain medications also, without having a proper like degree or something. They say like, if you eat this, your hypertension will go. If you eat this, we will never have a diabetes. How like according to you, might also have seen some videos. Is it like if you eat something particularly that you will not have hypertension? If you will take a certain medication, you will not have diabetes. Is it so?
See, it's a very important question because social medias and these platforms give us information, but in most of the case, it is misinformation. And people are wrongly guided. In some cases, it could be useful, but in majority of the cases, without having any scientific base, how can we use those things? And everybody is not same. If we have got two people with diabetes, their diabetes is different. Their treatment is different. If we have got, if we use these sort of things for whether they have got a grade 1 hypertension, grade 2 hypertension, hypertension with kidney ailment, hypertension with stroke, everybody will be having receive same sort of thing, which is totally unscientific. So it's always that we cannot prevent these things, but any person who has diabetes, who has hypertension, who comes across with these videos, he should go to his doctor once there's an appointment and other things, and discuss these things. And if the doctor finds there is some scientific base with that, he will guide. But they should not take the decision on their own. And we see patients, then they say, डॉक्टर साहब गलती हो गई, और कभी वो गलती irreversible गलती होती है, अब उनको kidney ailment आ गया. So we cannot prevent these things, but the thing is that they should have good communication with the doctor. And once they, this is not only with social media, even at home, there are our elders, there are our friends, and they can tell us certain things. So it's better to listen to them and go to your doctor and put these points and discuss. The doctor is better person to guide. If they are good, he can approve or she can approve. If they don't have any scientific basis or can be harmful, he may guide accordingly.
So, Dr. Saab, we talked about the importance of monitoring our blood sugar level or our blood pressure. So, oftentimes people here they go to a chemist shop, get their cells checked, but at the same time they take prescriptions from them. Like the chemist prescribes a medicine to the patient, like take this and you will be fine. Is it okay?
No, it is not okay because um, when we prescribe medication to some person, say for diabetes or for hypertension, we need to know their other organ functions. There could be one medicine if there is a kidney ailment along with hypertension, we may not prescribe that medicine. How on earth a chemist will decide about that? So helping people is very good. They're checking their blood pressure properly and checking their blood sugars. But giving the medicine, the best would be to suggest to them that please go to the doctor. Your things are not good. Sugar is not controlled and hypertension not under control. Then they will discuss over that. This is a very dangerous trend. Sometimes this also happens. Doctor has prescribed some medicine for hypertension and a person goes to a chemist and gets his self checked and blood pressure is okay. A chemist may say you can stop the medications. Again, a wrong thing. So doctor will decide about the treatment plan of a person.
Okay, Dr. Saab, we talked about so many things like monitoring your blood sugar, checking family history, everything. Some people at home they have their like blood pressure machines. They even have blood sugar machines. Can you tell us a particular range for every like adults, older people, and children that once they monitor at home, they say, okay, this is okay for my age.
See, if we say for blood pressure, for children we need different sort of blood pressure machines. The cuff size should be different. So for adults, if they are checking their blood sugar, first of all, we have to see that we should check blood pressure in the proper way. If our way of measuring blood pressure is not proper, we may end up in a wrong diagnosis. The first thing is that person should be calm, should have taken some amount of rest, say 5 minutes of rest, and the blood pressure should be checked in a sitting position. And the blood pressure machine should be at the level of heart. It's not that we'll keep it down or we'll keep it up, then there'll be variations because of gravity. Then the cuff size is also appropriate. Generally, the cuff which comes is good for everybody, but if a person is too obese or too thin, the blood pressure measurement with that would be inaccurate. So at least at home, we have to see these things in a sitting position, taking rest, then keeping the blood pressure machine at the level of heart. Then we have to see how to use that cuff. Then if we take one reading, it's better to take 3 readings after an interval of say a minute or so. Then we can take the average of those things. In fact, newer blood pressure machines are coming. They actually measure blood pressure thrice. Then they take the average and other things. So this is how we have to, if a person checks blood pressure at home in a squatting position, that's the way we do at kitchen. BP अब बदलाव देखते हैं तो we are sitting in cross-legged and other things. So this is not the correct way of measuring blood pressure. So this is how we have to monitor. Then a rough guide would be generally blood pressure. We have a two. One is the systolic blood pressure and then diastolic. Systolic blood pressure should be less than generally 120 or 130, and diastolic should be less than 85. But if you are elderly, in that case, it could be less than 140 for systolic and less than 90 for diastolic. And it also depends upon the underlying conditions. Suppose they have got kidney disease, then the targets are different. So we don't want to make it complicated at this point of time. So checking blood pressure at home is okay. Having a proper way to check it is also to be taken care of. Then generally speaking, any blood pressure less than 130 systolic and less than 85 or 80 diastolic is fine.
And what about the blood sugar?
Yeah, blood sugar. If a person is having diabetes and is on treatment and checks his blood sugar at home, if we are checking blood sugar in a fasting state blood sugar less than 130 is fine for that person. And post breakfast or post meal 2 hours, if it is less than 180, it's fine. But this is a gross statement. Things also change depending upon the person. If we are having a young person with diabetes, we may keep his blood sugar less than 110 for fasting and less than 160 for post meal. Contrary to that, if you have an elderly person at home having a cardiac issue, having say kidney issues, then in that case we may relax the targets. Even if blood sugar fasting is 140, that's okay, and post meal should now go beyond 200. So essence is that once a person goes to a doctor for consultation, they should also discuss about the targets. What should be my blood pressure or my blood glucose levels at home, so that they can get that guide and use that. Generally speaking, is less than 130 fasting, less than 180 for post meal, but it varies depending upon a person's condition.
Okay. Talking about some vegetables or fruits. Which fruit or vegetable are like a big no for hypertension patients and a big no for diabetic patients?
See, there is no for any of these conditions. A person can take all of these things, but we have to understand two things. If we see diabetes and we are talking about vegetables, a person with diabetes can take all vegetables. Only we can say regarding potato, because here we are in rice eating community in Kashmir, we eat rice, so that is a carbohydrate. And a person takes that rice with a lot of potatoes, then the spike would be high. So we have to cut down that. We have to cut down that. Rest of the things we should take in plenty. More important in this for this question is that what should be the proportion of the two things. We should have one proportion of rice, say, and equal or more proportion of vegetable, which is unfortunately not in our part of the world. We can have one plate of rice and we get a small amount of vegetables, which is a wrong trend. We have to change the composition of the two things. We have to decrease the amount of rice, increase the amount of vegetables. All vegetables, uh, they say, and if we talk of pulses and diabetes, there's a common notion over here, we cannot take pulses. But the problem is not with pulses. Problem is they are tasty and you have rice with that. So if we cut down the amount of rice and if we not cheat on that rice, we can take good amount of pulses. So there's no problem. Regarding hypertension, we have got two things. One is the amount of salt. Rest of, I don't think any we have got any vegetable where we can have big no. But important is that we have to cut down. If a person is having hypertension, along with that has complication in the form of, say, has got chronic kidney disease or diabetes has got chronic kidney disease, then their diets are a little bit different.
Okay, Dr. Sab, at the end, like we talked about a lot of things. If we'll summarize something for our viewers, that what they should do, how they should monitor, and the message at the end.
See, we can say certain points like, are we at risk? We are at risk. Am I at risk? I am at risk. So what next to do is get yourself checked. Check your blood sugar and check your blood pressure. If the things are normal, then we have to repeat them, say around 2 years after that. Then what things we can do to prevent getting these things is that we have to target modify the risk factors. Like we must be cognizant about our weight, and we have to strive for the ideal weight, and we must do a lot of exercise, and we must do away with smoking and a lot of sting, and we must take lot of fresh fruits, and we must have a sort of sense of happiness all around us, that it can then we can do it. And the simplest way is if we do exercise, all of the things get clubbed over this.
Thank you so much, Dr. Saab, for sharing your insights on these two important topics. Thank you so much for telling us that how important it is to monitor, and then if you have these two things, how to regulate them, how to take medications. Thank you so much.
Thank you. It was pleasure to talk on these two important topics. Thank you.
This was Heart Talks. I'm your host, Fajr Bilal. Stay healthy and stay tuned to the next episode. Thank you.